This one was from someone at camp, and this one was from my counselor at camp. And this one was from a friend.
I started coughing when I was pregnant with the twins, and I had it looked at during that pregnancy. I had it looked at on and off for over 8 years. It turns out the cough had nothing to do with the cancer, but thank goodness I coughed because it's what let me know that, it's what made me look into it. I was diagnosed with metastatic non-small cell lung cancer. And the feeling was scared, alone. It's terrifying. It's shocking because you are alone. Like, everybody's around you and everybody loves you, but life for everybody goes on if you die. And while that's my deepest wish,
Mom,
my biggest fear was dying and not being here to be with the people I love. I was told at one point that my chance of survival was very low. And it made me sick. Like, I got sick, and I almost passed out in front of my 3 little kids one morning while I was making them breakfast. There was a time when I couldn't go hiking, and I just couldn't do what I wanted to do, and I wondered if, would I make it to the next soccer game or dance recital or even to my son's wedding? Like, how could I possibly not be at the wedding? My lung surgery was quick and sweet, and then we learned that it was in 2 lymph nodes, so I had to do chemo, and they found it in my liver. I had liver surgery. I thought that was all. I then found out it had gone to my brain. I don't even know what the words are to explain brain tumor. Like, it doesn't get worse than that. And I still had to wake up every morning and be okay for my kids and lay in bed every night and cry with my husband.
How can I control it? Asked Meredith anxiously.
Purpose and Safety Summary. Important facts about Retevmo. It is also known as selpercatinib. Retevmo is a prescription medicine that is used to treat certain cancers caused by an abnormal gene called RET in adults with non-small cell lung cancer, NSCLC, that has spread, adults and children 12 years of age and older with advanced medullary thyroid cancer, MTC, or MTC that has spread, who need a medicine that can be taken by mouth or injection. Adults and children 12 years of age and older with advanced thyroid cancer or thyroid cancer that has spread, who need a medicine that can be taken by mouth or injection, and who have received radioactive iodine and it did not work or is no longer working. Your doctor will perform a test to make sure that Retevmo is right for you. It is not known if Retevmo is safe and effective in children younger than 12 years of age. Warnings: Retevmo may cause serious side effects, including liver problems. Liver problems, higher levels of liver enzymes, are common with Retevmo and may sometimes be serious. Your doctor will do blood tests before and during treatment with Retevmo to check for liver problems. Tell your doctor right away if you get any of the following symptoms of liver problems during treatment: yellowing of your skin or the white part of your eyes, jaundice; dark tea-colored urine; sleepiness; bleeding or bruising; loss of appetite; nausea or vomiting; pain on the upper right side of your stomach area. If you develop liver problems while taking Retevmo, your doctor may lower your dose, stop treatment for a while, or stop treatment permanently. High blood pressure, hypertension. High blood pressure is common with Retevmo. It may sometimes be serious. You should check your blood pressure regularly during treatment with Retevmo. Tell your doctor if you get any of the following symptoms during treatment: confusion, headaches, shortness of breath, dizziness, chest pain, heart rhythm changes, QT prolongation can happen. These may be serious. Retevmo may cause very slow, very fast, or irregular heartbeats. Tell your doctor right away if you get any of the following symptoms during treatment: loss of consciousness, fainting, dizziness, a change in the way your heart beats, heart palpitations, bleeding problems. Retevmo can cause bleeding, which can be serious and may lead to death. Tell your doctor if you have any signs of bleeding during treatment, including vomiting blood or if your vomit looks like coffee grounds, pink or brown urine, red or black stools that look like tar, coughing up blood or blood clots, unusual bleeding or bruising of your skin, menstrual bleeding that is heavier than normal, unusual vaginal bleeding, nosebleeds that happen often, drowsiness or difficulty being woken up, confusion, headache, change in speech. Allergic reactions. Retevmo can cause a fever, rash, or pain in muscles or joints, especially in the first month of treatment. Tell your doctor if you get any of these symptoms. Your doctor may stop treatment for a while or lower your dose of Retevmo. Tumor lysis syndrome, TLS. TLS is caused by a fast breakdown of cancer cells. TLS can cause you to have kidney failure and the need for dialysis treatment, an abnormal heartbeat, and may sometimes lead to hospitalization. Your healthcare provider may do blood tests to check you for TLS. You should stay well hydrated during treatment with Retevmo. Call your healthcare provider or get emergency medical help right away if you develop any of these symptoms during treatment with Retevmo: nausea, vomiting, weakness, swelling, shortness of breath, muscle cramps, seizures. Risk of wound healing problems. Wounds may not heal well during treatment with Retevmo. Tell your doctor if you plan to have any surgery before or during treatment with Retevmo. You should stop taking Retevmo at least 7 days before planned surgery. Your doctor should tell you when you may start taking Retevmo again after surgery. Common side effects. The most common side effects of Retevmo are higher levels of liver enzymes, higher blood sugar levels, lower white blood cell count, lower protein, albumin, levels in the blood, lower calcium levels in the blood, dry mouth, diarrhea, higher creatinine levels, this measures kidney function, high blood pressure, tiredness, swelling of your arms, legs, hands, and feet, peripheral edema, lower platelet count, higher cholesterol levels, rash, lower salt, sodium levels in the blood, constipation. Retevmo may affect the ability to have children for both females and males. Talk to your doctor if you want to have children and you are thinking about starting treatment with Retevmo. Retevmo can harm your unborn baby. You should not become pregnant during treatment with Retevmo. If you are able to become pregnant, your doctor will do a pregnancy test before you start treatment with Retevmo. You should use effective birth control, contraception during treatment and for at least 1 week after the final dose of Retevmo. Talk to your doctor about birth control methods that may be right for you. Tell your doctor right away if you become pregnant or think you might be pregnant during treatment with Retevmo. Males with partners who are able to become pregnant should use effective birth control during treatment with Retevmo and for at least 1 week after the final dose of Retevmo. These are not all the possible side effects with Retevmo. If you are concerned about side effects, talk to your doctor. Tell your doctor about any side effects you have. You can also report side effects at 1-800-FDA-1088 or www.fda.gov/medwatch. Before using. Before taking Retevmo, tell your doctor about all your medical conditions, including if you have liver problems, have high blood pressure, have heart problems including a condition called QT prolongation, have bleeding problems, plan to have surgery. You should stop taking Retevmo at least 7 days before your planned surgery, are pregnant or plan to become pregnant. See section above for additional information. Are breastfeeding or plan to breastfeed. It is not known if Retevmo passes into your breast milk. Do not breastfeed during treatment with Retevmo and for 1 week after the last dose. Also, tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Certain other medicines may affect how Retevmo works. You should avoid taking certain medicines when also taking Retevmo. These include St. John's wort, proton pump inhibitors, PPIs, such as dexlansoprazole, esomeprazole, lansoprazole, omeprazole, pantoprazole sodium, and rabeprazole. H2 blockers such as famotidine, nizatidine, and cimetidine, antacids that contain aluminum, magnesium, calcium, simethicone, or buffered medicines. If you cannot avoid taking PPIs, H2 blockers, or antacids, see the How to Take with Certain Other Medicines section below for more information. Know the medicines you take. Keep a list of them to show to your doctor and pharmacist when you get a new medicine. How to take Retevmo. Take Retevmo exactly as your doctor tells you. Your doctor may stop treatment or change your dose of Retevmo if you have side effects. Do not change your dose or stop taking Retevmo unless your doctor tells you. Swallow Retevmo capsules whole. Do not chew or crush the capsules. Retevmo is taken by mouth usually 2 times a day with or without food. Retevmo doses should be taken 12 hours apart. If you vomit after taking a dose of Retevmo, do not take an extra dose. Take the next dose of Retevmo at your scheduled time. Do not take a missed dose of Retevmo unless it is more than 6 hours until your next scheduled dose. If you take too much Retevmo, call your doctor or go to the nearest hospital emergency room right away. How to take Retevmo with certain other medicines. If you take a PPI such as dexlansoprazole, esomeprazole, lansoprazole, omeprazole, pantoprazole sodium, or rubeprazole, take Retevmo with food. If you take an antacid that contains aluminum, magnesium, calcium, simethicone, or buffered medicines, take Retevmo 2 hours before or 2 hours after taking the antacid. If you take an H2 blocker such as famotidine, nizatidine, or cimetidine, take Retevmo 2 hours before or 10 hours after taking the H2 blocker. Learn more. For more information, call 1-800-545-5979 or go to www.retevmo.com. This summary provides basic information about Retevmo. It does not include all information known about this medicine. Read the information that comes with your medicine each time your prescription is filled. This information does not take the place of talking with your doctor. Be sure to talk to your doctor or other healthcare provider about Retevmo and how to take it. Your doctor is the best person to help you decide if Retevmo is right for you. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Retevmo is a registered trademark owned or licensed by Eli Lilly and Company, its subsidiaries, or affiliates.